Good morning, guys. This is Kevin speaking from the University of Texas in El Paso. Today, me and my group of friends will be talking to you guys about a very special topic. Our name is Medicated Minds. This is
Diamond Ramirez.
Brittany Garcia.
Madison Spencer.
Miranda Flores.
And I'm Tony Sainz.
and today we'll be talking about a topic. What is the importance of the border, right? So we live in El Paso, Texas. We are sister cities to a city named Juarez, Mexico. So what is the importance of that border? Lots of people seek jobs from Juarez in El Paso. Obviously, over there, it's very poor. The poverty line is very low. A lot of people from El Paso travel to Juarez for international trade. So we get a lot of cotton. We get a lot of goods from over there. A lot of food. Again, tying back to that poverty, a lot of people go across the border to buy more cost-effective, for example, essentials like shampoo, medication, which is what we're getting into, drug prescriptions, more specifically opioids and Adderall, antibiotics, painkillers, and prescribed drugs. Again, they're cheaper over there. They're more accessible. And there was actually this research article that I was reading. It's called Cross-Border Purchase of Medications of Healthcare, which was done by the University of Texas in El Paso. And basically, they sent a survey out to 1,000 people, and natives in Juarez and El Paso. So it was 50% each. And they were obviously interviewing people who cross frequently. And they asked them about what kind of services they seek. And a lot of them were including, obviously, the prescription drugs, which is what we're talking about today, the dental services, the physician visits, birth delivery, hospitals, and other stuff like that. The main one was prescription drugs. That's what a lot of people are seeking over there. Now, if you...
So just like how Kevin had mentioned, El Paso and Juarez are sister cities. So a lot of people from Juarez will come over here and they'll go to school, they'll work, they'll come visit family members. And El Paso is also safer than Juarez, so that is why people decide to move over here from Juarez, from Mexico and things like that. And because of our relationship, because of how close we are, we share a lot of culture beliefs. We do a lot of the same social activities. We have a family from over there, over here.
Parties.
Yes. And since Juarez is the dangerous side of town, people go over there. They do more sketchy things. They, like how Kevin was mentioning, over there buying medication that will not be prescribed over here is easier. And that is why we have an opioid issue in El Paso, because a lot of people that don't get pre-approved over here from their insurance for any medication or anything like that, they find it easier to just cross over, go buy it over there from any type of pharmacy, any individual that might be selling it. There's been an issue also in schools. We've been seeing a lot of students that either they get curious or things like that. They might take it from their parents or from a family member. And since it's been seen in schools of children overdosing in high schools, things like that, a lot of schools now will stock up on, what was it called?
It's called Narcan.
Narcan? Yeah, it reverses the overdose, so it's becoming an issue even in children, not just in college students, not just in adults. So that's why it's important to talk about this and things like that, because it does start earlier than college. And also, since El Paso, it's safe, but it's still poor. We're not considered that high yet in terms of like insurance, things like that. A lot of people still struggle to pay for things like that. So over there, it can also be cheaper. Not only do we not get pre-approved or things like that, we also face the issue of just having the money for paying for medication. So a lot of people that don't get that coverage will go to Juarez to purchase it as well.
Yeah, so just like Diamond said, it's easier accessible. So medication access differs a lot between Juarez and El Paso. So why do people buy medication in Mexico? So it's easier access. Some medications, including low-dose opioids, are available without a prescription, so you can just walk into a pharmacy and ask,
Right.
can I get this opioid? Yeah, and then also it's lower cost. Medications in Mexico are often cheaper than the U.S., And there's also higher doses. So some medications are available in stronger doses than what is typically prescribed in the U.S.
Right.
Like morphine. You can buy
Right.
morphine over the counter over there. It
And no
comes-
questions asked, they just give it to
like,
you.
Here
And
you
just get
go.
it and
Yeah.
here you go. Because it's typically like when you go over there, there's a lot of like dentists. So when you go to the dentist, you obviously need something stronger after. So they just give you that, and you walk in, you ask for it, and they're like, okay.
And you know what? It's crazy because my aunt just recently got like a list of medications from here that her doctor prescribed, and now she's going to take it to Juarez to see if they're going to be cheaper over there.
Yeah, and it's
So,
crazy.
yeah, it all ties in.
Yeah, so the most commonly purchased medications are antibiotics. Just like Brittany said, her aunt's going to Mexico to see if they are cheaper, which they are. So it's usually controlled substances. Sometimes some pharmacies in northern Mexico have actually been found selling oxycodone, Xanax, and Adderall,
Right.
which are laced with fentanyl and heroin, which is causing the overdoses in the schools for the children, the children, yeah. So there is also prescription requirements and pharmacy oversight. It's much stronger over here in the United States than it is in Mexico. So opioid prescriptions, which is the DEA, they are highly regulated, which is you can only get, I believe, 2 weeks worth of supply. And then after that, you have to go to the doctor, see if you need it again, and then you have to get it prescribed, and then you
Yeah.
have to get it like sent through like everything for you to be able to get it back again. And then so doctors must follow the strict federal and state guidelines. There's prior authorizations, there's prescription monitoring databases, and then in Mexico there's something called the COFEPRIS regulations. So it varies between pharmacies whether the pharmacies want to follow it or not. So there's low dose opioids available over the counter. They offer a prescription, but you don't have to get the prescription. You can just walk into the pharmacies and get it.
I get it. Well, and then you know what? I recently had to get tramadol, my primary prescribed tramadol for me, and it goes through like this whole system. Like they send it through a different system because he was struggling to get it through because that system was down, and I didn't know that. So it's crazy to know that you can just
Yeah.
walk in. It's like, hi, hello, here you go, thank you.
Well, you'll get that experience, girl, when you go over.
I was
And your
actually going
aunt
to
too.
add to what she was saying about being prescribed, like the system and all that stuff. But I was reading that either ways, if you get prescribed a drug that strong, it already like opens up the risk to get addicted because you're already getting exposed to it. And a lot of people get dependent on it from just that first time in the 2 weeks because they're like, oh, I really felt good, or it really took away the pain. So yeah, either ways, getting exposed to the drug will already increase the risk of ODing or just getting addicted to it. So.
No, 100%. And then beyond the availability and the access, the easier access to these types of medication is for us as students, the cultural expectations that we have and the economic hardships that we go through, and also the difficulties of being the first-time student. For us, all of this can contribute to the particular academic pressure that we have here in the El Paso Juarez border region. In order to support our families, many students balance a lot of coursework, and then there you go to their part-time jobs, their full-time jobs, and with the added additional strain of being a first-time college student, we can sometimes bear the burden of our relatives' pressure on us to get good grades, to maintain our GPA up there, and apply to grad school and get the ball rolling. But some students they look for shortcuts, and they
Yeah.
feel that they can't handle this type of academic pressure without the assistance. And as we know, Adderall, super common, and it's also referred to, well known as the study drug. It becomes a tempting alternative, and particularly in students who believe that failure isn't an option. The temptation for us is it's even heightened by the possibility of just going to Juarez, where it can be easier, as we had mentioned, to obtain, and for others it could be buying a bulk and bring it over and then having that supply just in case. Or
Yeah.
for others, it could be a classmate that has a valid prescription and they give us one, or we can get a couple from them, right? But sometimes what happens is that we're unaware of the legal or even our own health concerns because of us taking that drug. And as we know, as we see it sometimes, it could be as a tool for academic success, right? But in reality, the abuse of Adderall only conceals the stress. It really doesn't remove it, you could say. And we've read that long-term usage without the medical supervision that it actually requires can result on the dependency on it. It can result in anxiety, sleep disorders, and even cardiac problems. And even though it might offer a brief increase in energy and in focus, students find it more difficulty operating without it as their need grows. and which can in turn lead to a vicious cycle of dependency that could really be challenging to escape, or even challenging to function without it.
Yeah.
And the academic pressure, that's the true issue that we face. It's, for some at least, but it's not the inability to focus. More awareness of the resources available should be made by the educational institutions and everyone who is aware. This is in order to help students manage their workload in a healthier way.
You know what? In my personal experience, there's been like a couple of students that I know from PhD programs that are doing, you know, their current research that are actually prescribed with ADHD here, so they're able to go to a mental wellness place, get prescribed with ADHD, and that's the reason why they go get the Adderall. So the Adderall isn't always a bad thing, but again, you mentioned a good point where they bring it, and then they give it to other people, they distribute it, so now those people are going over there and getting it for themselves.
Yeah.
But
no,
yeah.
100%. Some people really do need it, right? But it's the
Right.
lack of supervision.
Yeah.
When someone were to take it without
Exactly.
the proper supervision, it could fall into a cycle.
Yeah.
Right. And now the access to study groups, the time management classes, and mental health counseling, and even discussions that we are all doing, are essential ways to help others not fall into the dependency that we're talking about, right? And as a student, our well-being should really never be sacrificed for success. We need to address these demands in a way that encourages long-term sustainable success rather than just Band-Aid solutions, right?
No, yeah, so like how you guys have mentioned why we cross for the lower cost or lack of prescriptions or restrictions, it may be cheaper, but in the overall big of things, it's easier to get a hold of, but it undermines the drug regulations designed to ensure safety. And for the most part, over there in Juarez, since it's not the safest, there's a lot of exploitation in black markets. And it involves illegal markets, counterfeit drug trades, or unethical pharmaceutical practices. And even how Brittany mentioned how her aunt went with a list for Juarez, a lot of the medications are involve harmful ingredients or incorrect dosages or no active ingredients at all. The World Health Organization actually estimates that 10% of medical products in low and middle income countries are poor quality or falsified. And of course, like the misuse of Adderall and opioids causes a lot of health complications, leading to heart problems, psychiatric issues or addiction, and a lot of respiratory failure and fatal overdoses. And even though doctors and pharmacists are responsible for informing patients about the risk of self-medication and seeking drugs outside of regulated healthcare systems, most individuals just don't care in general because they prefer the cheaper option.
Yeah.
Yeah.
Right. So just like everybody has been mentioning, there's just so many environmental factors that take into play. And, you know, personally, I did not know so much about opioids and Adderall, or how you even mentioned starting off with maybe tramadol. I was kind of scared to take that, by the way, because of course it all leads to addiction. It can be, you know, a lot of people are not aware of the health risks that it involves, right? So we've already explored the complex relationship between El Paso, Juarez, when it comes to the medication access, from both historical and socioeconomic factors that shape the issues to the real life experiences for individuals here and over there as well, and students, right, like Tony was saying. As a person who's pursuing a graduate school for PT, I do feel a lot of pressure. You know, last semester I was running on 45 minutes on sleep during finals just because I was staying up studying, you know? And unfortunately, they're just the type of sacrifices that us students have to take in order to get where we need to be. And,
Right.
you know, it all ties down as to what does this mean for us as a community, right? What support groups is there for students and individuals? You know, lack of promotion and awareness of these types of topics. And how can we actually address the affordability and accessibility issues in our own healthcare system? Where's the problem? Where's the root of the problem, and how can we fix it, you know? And, you know, if this conversation resonated with you, if you feel the way we feel as a student, as an individual yourself, you have family members like we've all shared, it's important to educate yourself and others on healthcare policies, on the impact on border communities. Advocate for policies that improve medication access and affordability. Support organizations working to provide safe and legal healthcare options for those who actually do need it, right? You know, we have mobile clinics. Maybe we can have mobile pharmacists. You know, I've never heard of such a thing, you know, like where
Right.
pharmacists promote such awareness of the medication they're prescribing, you know? And just because, like, maybe we were saying that sometimes people get, for ADHD, they do get prescription for that as well, and then they distribute it, and we don't know the long-term effects that it could have in our life, you
Right.
know? we don't know if maybe with one or two we're going to get addicted, and that's it. And there's no way out of it. And then
Everybody's different, right?
Exactly. And then the support systems for those people are different, you
Yeah.
know? Like, not everybody has a good support system at home or outside of school. And then what happens then, right? So for more information on healthcare access, medication safety, and advocacy efforts, it's important to check out resources, which we will link below with our podcast as well for
Yeah.
others. And we appreciate the time that you're taking to listen and engage with this important discussion. This is a conversation that does need to be continued and does need more awareness, and we hope it sparks that and action in our community as well. And thank you for joining us, and until next time, stay informed and safe, everybody.